Hello and welcome to the Department of Neurosurgery Pre-Operative Spinal Seminar. My name is Kate. I will be narrating this seminar. Before we begin, please don't feel as though you need to be writing everything down, as this document may be printed, and most of this information will be contained in your discharge instructions. Let's begin. Today we will be speaking about preparing yourself in your home for surgery, what to expect throughout your hospital stay, your expectations and goals for after discharge from the hospital, and I will be available via email or patient gateway for any questions and or concerns. For purposes of the seminar, you would need to know whether your procedure is considered a fusion or a non-fusion. There are a few differences between the two, and I will explain. For patients who are coming in having a non-fusion procedure, many of you will be staying for 23 hours. Some other specifics that you need to know: your recovery time will be shorter. We do allow people to smoke after having a non-fusion procedure, although we do not recommend it, and the use of NSAIDs. People often say, what are NSAIDs? What does that stand for? It stands for non-steroidal anti-inflammatory drugs. Drugs that fall in that category, to list a few, but are not limited to: Aleve, ibuprofen, Motrin, Advil, or naproxen. We encourage our non-fusion patients to try to use NSAIDs around the clock. For my fusion patients, some of my smaller fusion procedures as well will be here for 23 hours. My multi-level lumbar fusions are patients who usually have a longer length of stay. The recovery period for fusion patients, whether it's a single level or a multi-level, is a longer period of time. Please take note that the fusion process, the bone growth, could take anywhere between 6 to 12 months to completely grow. Cigarette smoking is prohibited after a fusion process, as well as taking NSAIDs. The two of these slow down the fusion process, so we do highly recommend that you refrain from cigarette smoking, and we do say that the use of NSAIDs is prohibited for 3 months postoperatively. So when weaning off your pain medication or looking to take something to help with your pain medication, we do ask that you turn to Tylenol. Patient education in the hospital. We are a teaching hospital. Starting as early as today with your preoperative seminar, there will be education taking place throughout your surgical journey. Some of the main things that we focus on: number one, being blood clot prevention. And you will hear throughout this seminar today how we encourage you to be up and ambulating as early as possible postoperatively. Pain management, talking about your pain management plan, reviewing your list of medications, reconciling meds, all have to do with your medication plan. The use of ice and or heat is extremely important postoperatively. Ice within the first 48 to 72 hours is highly recommended because it does help with swelling and pain management. I usually tell people, if what you're experiencing postoperatively is more a tightness or a spasm, that is when you may turn to something like heat. We will be going over the signs and symptoms of an infection, when you should be calling a doctor, having someone available to do a wound assessment on a daily basis. Pre-surgical checklist. Things that you should be thinking about doing prior to coming in. The most important thing is your Weiner Center appointment. Whether you have been chosen for a phone screen or to appear in person at the Weiner Center, this is a checkbox that is a must. You must complete a Weiner Center appointment prior to surgery. Without this Weiner Center appointment, you are not allowed to have your surgery. We will be talking about home preparation prior to coming in, and we'll also be discussing the fact that you will need a reliable person to come in and pick you up on the day of discharge. We do our best to let you know what your length of stay is, your expected length of stay prior to coming in, so that you can have somebody readily available on the day of discharge. And again, please confirm that you do have a post-operative appointment scheduled prior to leaving the hospital. Meet your care team. Starting at the top of the team, we have the attending physician who works with fellows, residents, PAs, and NPs. The nursing staff works with PCAs and nursing students. We have a physical therapy team who many of you will see. They work with aides and students. And then we also have a very unique group of nurses that work with us here at the hospital, and they are called the Care Coordination Team. They specialize in home physical therapy or rehab placement. They will set up VNA services to come out to the house to do home PT. This team meets every day on daily rounds, and we discuss discharge disposition starting as soon as your day after surgery. So again, if there are services needed once you leave the hospital, the Care Coordination Team will arrange for any and all services that are needed postoperatively. Your Weiner Center appointment. For those of you who are still planning on attending the Weiner Center appointment, I'd like to review the things that will be happening while you're there. Your blood work will be done. Some of you may be having an EKG. Your vital signs will be checked. They will be reviewing your medical history. They will review your current list of medications. They will be speaking to you about eating preoperatively and when you should stop eating solids and when you should be transitioning to clear liquids. They will talk to you about alcohol consumption and the need to stop consuming alcohol a week prior to coming in for your surgery. They will be speaking to you about smoking cessation. We are a non-smoking facility and a non-smoking campus. We do encourage people to stop smoking cigarettes a week prior to coming in for surgery, and I will reinforce for my fusion patients that smoking is not allowed postoperatively. They will also be speaking to you about infection prevention. For those of you who have an in-person Weiner Center appointment, you will be receiving a bottle of Hibiclins from the Weiner Center. The Hibiclins is a pre-op solution that we use for a pre-operative wash. The instructions for using the Hibiclins are as followed. You are to do 3 washes with the Hibiclins on 3 consecutive days prior to your procedure. The first wash is done 2 days before. The second wash is done the day before. And your last and third wash is done the morning of surgery. We ask that you get into the shower as you would on any normal day. And just prior to stepping out of the shower, just prior to finishing your shower, I ask that you use your Hibiclin solution with a wet face cloth. I usually encourage patients to try to use 1/3 of the bottle with each wash, and to please start with your surgical area. You may wash the rest of your body surface. This is a solution that is used on your skin. It is not to be put in any openings or orifices of your body. Again, it is a pre-op wash. By using 1/3 of the bottle with each wash, you should be emptying the bottle the morning of surgery onto that face cloth. Once you complete your third wash, I do ask that you place that bottle in the trash, as we do not, I will say it again, we do not want you using your Hibiclens solution post-operatively. They will be reviewing your smoking history. They will be reinforcing that my fusion patients cannot smoke post-operatively. They will speak to you about your alcohol consumption, and they will speak to you again about eating and drinking prior to come in. We do ask that you stop solids prior to midnight, the night before surgery, that you transition to clear liquids, and please understand that clear liquids are a liquid that you can see through. So something like a cup of tea cannot have cream or milk added to it. Again, it needs to be a clear liquid. The Weiner Center will then give everybody a cutoff time when you are allowed to have nothing by mouth. And it's very important that you follow these instructions. Another point that has been brought to my attention is that putting gum or mints in your mouth prior to surgery is discouraged. By using mints or placing gum in your mouth, it has your stomach call for the production of gastric secretions, which will then upset you post-operatively, may lead to some post-op nausea. So I do tell people when they say nothing by mouth, they mean nothing. For those of you that have questions pertaining to what pills are allowed the morning of surgery, again, when they review your med list at the Weiner Center, they will be telling you what you can and cannot take the morning of surgery. Home preparation. I do encourage you to spend a day or two prior to coming in and look around your house, see what kind of things may be a trip fall hazard at home. Things like throw rugs, scatter rugs, excess boxes, extension cords. Many of you may be going home with a walker, so you do want to make sure that your hallways, pathways from the bedroom to the bathroom, or from the bathroom to the kitchen or your sitting area, are clear and free of things that could be considered a trip fall hazard. Placing items used on a daily basis at a convenient height and or location. And what I mean by this is if things like your socks or your underwear may be in the bottom dresser drawer, you may want to think about placing items like that at the top of your dresser or at a convenient height to limit your bending or twisting post-operatively, which may lead to increased pain. Things like your shave bag, your cosmetic bag, you may want to place on the top of the vanity. A roll or two of extra toilet paper, you may want to think about placing items like that on the back of your toilet tank. So again, spend a day or two prior to coming in, thinking about the things that you may be reaching for, heavy items that you may be tempted to take out of the cabinet, or things that you may be bending for. We do encourage that you leave your valuables at home. So I do tell patients, please do not come in with your work bag, with your laptop and your handheld device. There's no need to come in with a wallet full of cash or credit cards. Jewelry needs to be removed, so any piercings, earrings, necklaces, things of that nature do need to be removed prior to coming in. Get your chores done before coming, and I think this is a very important point. Get your grocery shopping done. When you go out to grocery shop, you're going to be thinking about maybe getting in a week or two worth of your groceries, especially for those of you who are home by yourself, who possibly live alone. People that do the grocery shopping, get items like cases of water, dog food, kitty litter, things that may have some weight to them, which we would discourage you from picking up post-operatively. So stock up on these items. Get your laundry done. Get caught up on any chores that you may have around the home so that when you do go home post-operatively, your focus can be on healing and being up and walking and limiting things that may be heavy activities for lifting purposes or things like that. Things that you should bring to the hospital. If anybody has workers' comp paperwork, insurance paper, short-term disability paperwork, I encourage you to get that in preoperatively, but if you have not, you can go ahead and bring it with you on the day of surgery. You also need to come in with your license, a form of identification to identify yourself the morning of surgery. And we do have a pharmacy here at the hospital, so a form of payment, a small amount of cash or a credit card for anyone who may be wishing to fill your narcotics here at the hospital. Anyone who wears contacts, I do tell you that you must come in eyeglasses, as you are not allowed to go under anesthesia in contacts. Hearing aids, and a list of medications. Again, things that you should be bringing with you into the hospital. Patients that use CPAP machines, I also encourage that you bring your own CPAP machine with you. It'll just make things run a little bit smoother for you, but we will have respiratory work with you if there are any needs. As far as your clothing is concerned, I generally tell patients to please come in loose, comfortable clothing. For patients having lumbar or lower back surgery, you want to think about coming in a loose, comfortable pair of pants, something with maybe an elastic waist or a drawstring. And for patients who are having cervical or neck surgery, possibly something that buttons or zippers up the front, as it will be much easier to get on postoperatively as opposed to pulling something on your head. And everyone should be coming in a pair of walking shoes or comfortable rubber-soled shoes. But again, if you do have any concerns in regards to this seminar, you may reach out to me via Patient Gateway. My name is Kate Hill, Hill, or I can be reached via email at khill@bwh.harvard.edu. Thank you for participating in this seminar, and I look forward to meeting you postoperatively. Take care.